because a father of two has said that a headset that stimulated his brain using electronic pulses has been a key part of his recovery from depression. Ashley Riley from Northamptonshire took part in an NHS trial that used the device to treat the disorder. He signed up after medication alone failed and said he's now able to be a full-time dad again. Well, let's speak for the next few minutes to Ashley Riley. We'll also talk in a moment to Professor Alex O'Neill-Kerr, who's the Medical Director of Transforming Minds. But Ashley, welcome here to BBC News. This is really, as I was saying, a fascinating story. So tell me, first of all, how it works, how often you wear the headset and what actually happens when you do wear it.
Hello, Matthew. It's really good to be on, and it's great to talk about this new treatment that I'm having. I wear the headset, which is called Flow. I wear it once a day for half an hour, and it's a very easy thing to use. It pairs up with the Bluetooth on your phone. It sits on your head. You can watch the telly, you can do emails, you can do whatever you want. You get a very small tingling, like a little bit of pins and needles at the front of your head. And you do it every day, and over time it's part of starting to make you feel better, and it's really been a key part of my treatment from what was quite a traumatic year last year for me.
Well, I don't want to put you through it again, but just describe for people watching just the difference this device has actually made, because you've been part of a trial. So just describe what your life was like before you started using this and how that compares to what it is like now.
Yeah, so it's the last year I had a pretty horrific year. I had some mild anxiety and mild depression, like lots of men my age, between 45 and 55, experience. Unfortunately for me, it got worse. So I felt very down, very tearful. I tried lots of different medications from the doctor, but they made me worse. So I ended up on 3 different types of antidepressant. They just didn't work for me. They made me worse. Unfortunately, I became psychotic. I had to go into psychiatric care for 10 days because I was becoming so very poorly. And when I came out of there, as part of my medication and my psychotherapy, I was introduced to Flow as one of those 3 treatments that I had. And using Flow and using psychotherapy, one of the main things it's helped me with is reduce the medication, and it's improved my mood, it's improved my condition. And I'm pretty much back to normal. I'm becoming the guy that I was before, and I see this headset as really a key part of taking me out what was a really dark and what at times felt like a really hopeless experience in my life. And it's really great for people like me and millions of others that go through mental health challenges, that you can get better, you can get through this. And this equipment, this Flow equipment, has been a key part of that for me.
That is so good to hear, and we use that line that I know that you have, that you're back to being the dad that you always wanted to be, but it sounded as if there were times where you were really desperate. Did you think when someone suggested this, there was any chance of just transforming your life in the way it has? I read that you're back to work, is that right?
Yes, absolutely. So I run my own business. I run a PR and marketing firm, and it's so good to be working again and being a proper, what I call a proper dad and a proper husband again. And I just remember at some of the darkest times that my daughter would ask my wife, why is daddy crying so much in the toilet? And you look back at those times and they're really hard, but to be able to be a proper dad again and a proper husband. And when you go through these really awful challenges of anxiety and depression, you just want something to hope for. You want to grab onto something that can help you. And when I was introduced to the headset, you were initially a little bit skeptical. How can this help? I'm not putting electrics in my head, am I? But I tried it. It's been part of helping me get better. And I'd wholly recommend it because I am a different guy than I was a year ago. And my kids are getting their dad back. My wife is getting her husband back. And it's part of the treatment I'm getting. And it's just a really good place to be. And so I look back at some of those pretty horrific times that I went through, but I can look back at them now and reflect on them more than be scared by them because of where I am now.
Ashley, I can hear the emotion in your voice as you just describe what the change has been like. Thank you so much for for taking time and speaking so honestly. Let me bring in, as I said I would, Professor Alex O'Neill-Kerr, who's Medical Director of Transforming Mind Solutions, a clinic in Northampton which provides neuromodulation services. Professor, thank you so much for being here with us. Just for people listening to that that account, but scientifically, how does a device like this actually work?
Well, this is all due to a new way of looking at depression and anxiety, neuromodulation. So previously we kind of talked about a psychiatrist's imbalances of chemicals and problems with serotonin and noradrenaline. Now we're starting to understand that actually it's the way the brain connects itself up and the way it disconnects itself that seems to be part of the story as to how people get depressed and anxious. And the story is a very common one. I hear this all the time. People having neuromodulation, they don't respond to antidepressants, they have neuromodulation. People say, I've got my father back, I've got my daughter back, I had the best mommy hug I ever gave my pet, my child, because the emotional responses come back. People are able to go back to work, they're able to work, they get their concentration back, they get their mojo back, basically, they get up and go, comes back, their motivation comes back.
And how does it make the brain different? Because I know that you have experience with this, that so often antidepressants are used that after 3 or 4 different rounds, sometimes doctors have to give up, they simply do not work.
Well, that's true. We know that from a very big study done in America called STAR-D study. It was nearly 3,000, or just over 3,000 patients, outpatients in America having antidepressants. And then they looked at what was the first antidepressant, the second, the third, and the fourth. The outcome of that study was if you failed to respond to 3 antidepressants and psychological therapy, you're not going to respond to antidepressants. Or you may respond to an antidepressant in the 3rd antidepressant or the 4th antidepressant, but within a year you will have lost that response.
Yes.
So it really tells us that there is this group of patients, about 30 to 40% of people with depression, who do not respond to antidepressants, and we know that.
Just a final quick thought, sorry to cut across you, but I read that you were relatively skeptical when this was first suggested. Tell me more about that. And also, does it work for all patients? This is a trial. In terms of those that were involved in the trial, was it uniform in terms of the outcomes that you saw?
Well, so basically the trial we looked at was a feasibility trial. Can we put a transcranial direct current stimulation devices, headsets, into an ordinary general adult community mental health team? And can we use it? Does it work? Do patients like it? Do patients not like it? And by and large, people really liked it and they were getting better. And it gives us something else to give people in anxiety and depression, where generally we don't have very good medications for anxiety.
Yes.
I was skeptical because it's such a minute amount of electricity. I mean, it's 2 milliamps and used to come from a 9-volt battery. But it's basically stimulating the left side of the brain and inhibiting the right side of the brain.
Professor, we have to leave it there, but absolutely fascinating, this trial. So thanks for your time. And Ashley, thanks for your time and your earlier accounts. Thanks to both of you.
Thanks.